Good morning, everyone. It's so wonderful to see so many of you here with us this morning for our new resilience event here at Soho House. Those that I have not yet met, my name is Victoria Smart and I am from the Beauty Triangle. And I am honoured to be joined this morning by three fantastic wellbeing practitioners who are going to be discussing the routes to build resilience. Because I'm sure we can all agree that stress can really impact us in so many ways, both physically and mentally. And it can impact the way that we look, the way that we feel, and the way that we function. So what are the techniques that can help us feel stronger, both in body and mind? How can we look more rested? How can our bodies feel stronger? How can we improve our posture? And how can we regulate our nervous system and feel a little more calm through each of our days? Those are just some of the things that we'll be exploring this morning. But just before we do, just some housekeeping. You should have found a programme on your seats. On there, you'll find further information about all three of our practitioners and a referral card. So should you wish to be connected with any of our speakers, please just pop your details and we'll connect you directly following the conversation. You should also have grabbed a goodie bag on your way in. In there, you have some fantastic magnesium products from Better You that will really help you feel rested after this conversation. And finally, we'll save some time for questions and answers at the end. So if you do have any questions, please just hold them till then. And I'm sure our practitioners will be around after the conversation. And before we begin, just a few words about the Beauty Triangle for those that aren't familiar. We launched 6 years ago now in order to educate and empower audiences on all areas of their well-being. And importantly, from a holistic point of view, which is why you will always find 3 practitioners on our panels, each of whom are an expert in their field. But we also launched in order to connect you, our audiences, with some of the most authoritative voices, which brings me very neatly to introduce our speakers today. We have consultant oculoplastic surgeon, ophthalmologist and aesthetic Dr. Miss Elizabeth Hawkes. We have consultant physiotherapist, Florence Penny. And we also have breathwork coach and facilitator and founder of the Breath Space, Jamie Clements. Now that's enough from me. I'm going to hand over to our speakers to say a very quick hello, introduce themselves, and then we will begin with the main conversation. Elizabeth.
Great, well, thank you so much for having me. I'm really excited to be here. So as you said, I'm Elizabeth Hawkes and I'm a consultant ophthalmologist and oculoplastic surgeon. That means I've trained as an eye surgeon and specialised in the eyelid skin. And I have an area of expertise in blepharoplasty surgery and facial aesthetics from the neck up.
Thank you so much. Flo?
Hi, I'm Florence, or Flo. I founded Flow Physio London about 4 years ago now. I've been a physiotherapist for coming up to 14 years. I specialise, so I'm a consultant physiotherapist specialising in musculoskeletal injuries and sports. And I've got clinics both in Knightsbridge and Marylebone, but also span lots of home visits as well around the area. And I've grown a small team to kind of help people with their ailments, or also what we're finding is we're entering that very much that preventative space as well.
Thank you, Flo. Jamie?
Hi, everybody. I'm Jamie Clements. I'm the founder of a business called the Breath Space. I've been a breathwork practitioner and facilitator coming up to 6 years now. My specialty really lies in creating spaces to support people in reclaiming awareness, autonomy, and purpose in their lives. That's through retreats, through workshops, through digital offerings. I have an app as well. And really just supporting people through breath, through psychology, philosophy, and modern neuroscience to come back to themselves.
Thank you so much. So, Elizabeth, we're going to start with you. You mentioned that you do a lot of work around the eye area, but optimizing all areas of the face. I'm really interested to hear more about how that impacts not just our physical appearance, but also our mental well-being as well. But could you just start by explaining who your patients are and what their main concerns are?
Yeah, definitely. So with my background and expertise in eyes, most of my patients find me because they're looking for rejuvenation of the eyes and the eye area, whether that's a surgical solution or a non-surgical solution. That's the most common reason for a consultation. And common concerns I hear is patients say they feel they look tired when they're not. They've noticed new changes around the eyelids. So women will classically say that they've got hooded eyes, their makeup's starting to smudge. Men will say they're starting to look tired and bleary-eyed. And in the lower lids, puffiness in the lower eyelids.
I'd love to touch on some of the things that we can do to optimise those things when we're feeling like we're looking a little tired. Before we go into some of the non-surgical treatments, what can we be doing from home? Are there eye creams that can help? What can we be doing for our skin health?
Yeah, definitely. So I'm a big advocate for eye cream. I think it's so important. The eyelid skin is completely different to the face skin, and there's multiple studies that explain why. The skin is thinner, and it's more prone to stress from UV. And underneath the skin, unlike the rest of the face, which will have a layer of fat, the eyelid skin just has the muscle, the orbicularis oculi muscle, and that's responsible for blinking. So we're blinking about 15,000 times a day. So you can imagine the eyelid skin is under a lot of stress. So it's so important that you use an eye cream, and it's so simple to do at home. So the one I always recommend is SPF to use around the eyelid. And not only will it help slow down the aging process of the very delicate eyelid skin, but it can also prevent the formation of cancers around the eyelid. And that's a big part of what oculoplastic surgeons do in the NHS, is reconstruct eyelids. And you can do something really simple just by wearing sunglasses as well. Oversized sunglasses will help to protect the skin. So that's definitely my number one eyelid skin care.
Are there any other active ingredients that we should or shouldn't be using around the eyes? Because I think we sometimes hear of all these active ingredients, but don't put them near your eyes because they're dangerous. What should we be looking out for?
Yeah, that's a great question. So other ingredients, it really depends on the concern. So the three most common concerns I hear from patients around the eyes are fine lines, puffiness, and dark circles. So I think if you really want to hone in on a particular concern for something like puffiness, well, puffiness is prolapse of the orbital fat. So it's out their eye bag. So your eyeball's in a bony socket and it's cushioned in fat. And what can happen over time is the fat can come forward, and that gives us puffiness on the lower lid and a little bit of puffiness on that upper inner corner. So what can you do to help reduce that? We can't really get rid of the fat, but creams that contain caffeine, which is a very powerful vasoconstrictor, can actually help, because as well, sleep or lack of sleep that I know we're coming on to can increase fluid accumulation around the eyes. So you may want to introduce a cream with some caffeine in for puffiness. If you want to improve dark circles, well, dark circles is an interesting one because there's often potentially there can be a medical cause as well. It can be genes, genetics, or it can just be poor circulation. So creams you may want to use are creams with, say, a topical vitamin C, because it's a very powerful antioxidant. Creams with niacinamide as well, because that is a very powerful brightening agent. And you can use more natural ingredients, like look for creams with kojic acid in as well. That's a powerful antioxidant. So that will help with dark circles. And if it's not enough, there are prescription creams that you can get from a specialist.
And what role does self-massage play? We're always told like massage our eyes to make them look less puffy. Is that a myth? Does it work?
No, it definitely works. So the eyelid, as I've said already, it's very unique. And it's quite common to get collection of water or fluid retention on the top of the cheek, and that's called malar edema, and it's quite a common concern for patients. And really, if it's very mild, you're looking at at-home massage. So lymphatic drainage massage is really good. The way you need to do it is always important to be gentle around the eyelids because you don't want to accelerate the eye bags coming forward. So you just sort of tap around here, do lots of facial grimacing and really massage into the outer corner because the lymphatic system will always drain here in the ear and through the neck. So there is definitely a role in massage, and I do often recommend patients to have lymphatic drainage facials if they're concerned of puffy eyes.
I tried eye yoga recently, and that was really fascinating. I don't know if anyone here has tried it, but I highly recommend it. It was quite an experience. So once we've tried from home, what can we do when we're coming to see you? What are the non-surgical treatments that we can be expecting for you to be offering?
So I offer the full range from anti-wrinkle injections, dermal fillers, platelet-rich plasma, and the regenerative treatments like polynucleotides from a non-surgical point of view. But it really depends what the concern is and what your findings are. So it's so important to have a thorough consultation and, just fess up. If you say you had filler 5-10 years ago and you regret it, just say, because that can often help guide a bespoke management plan. But it's often a combination, and non-surgical treatments do work really well for the lower eyelid in particular. There's lots of options you can do to rejuvenate the lower eyelid. The upper eyelid can be a little bit more tricky from a non-surgical point of view, so you'd be looking at doing some carefully placed anti-wrinkle injections to raise the brow, take away some of that hooding, but really the gold standard would be a surgical blepharoplasty. But there's lots you can do in the meantime to delay the need for surgery, and that's why I started doing non-surgical treatments in my practice in the first place.
I'd love to touch on some of the more regenerative aesthetics that
Yeah.
you spoke about a moment, but is there any benefit to the argument of saying that makes us feel better, less stressed, happier? Because isn't there the study that shows that toxin can lift and make us feel like we're smiling more, less frowning? That can make us feel a certain way.
Yeah, definitely. And that's how Botox, botulinum toxin, was discovered from a cosmetic point of view. It used to be done for this medical condition called blepharospasm, which is when you can't stop blinking. And the patients would have carefully placed Botox. And then what the doctors found, the ophthalmologists found, is that actually their blinking symptoms got better. But they still came back for more Botox, and that was because it softened the frown line and their eyelids were looking more open, more lifted, and they were looking more rested, and that's sort of how it was pioneered.
That's really interesting. I'd love to touch on filler, because I think we hear a lot about tear trough filler, both good and bad. Should we still be using tear trough filler? What are the fors and the againsts of using that?
Yeah, so I still use dermal filler in the tear trough region. So I think we've learnt a lot on dermal filler over the last few years. So dermal filler is essentially hyaluronic acid, and it's a gel and it's a volumizer, and it's cross-linked to last longer than natural hyaluronic acid, which wouldn't last very long. It's got a good role and a well-established role in the tear trough, which is the area underneath the eyelid, but it has to be used correctly. So if your main concern is volume loss and you're starting to see loss of volume in this region, then definitely tear trough filler is the right treatment for you. However, if your main concern is puffiness, adding more volume is not the right answer or solution, because you'll just look more puffy. Also, if you have any signs of swelling in the top of your cheek, you just don't want to have tear trough filler in. So tear trough filler definitely has a role, and I use it, but it's so important in the right patient. And also the sort of practice of coming once a year for top-up tear trough filler, that's outdated now. We know that tear trough filler lasts a long time, and it's okay that it lasts a long time. It's not harmful. But you don't want to be topping it up every year. And luckily, there's lots of other options that we can do to rejuvenate the under eye. You don't have to keep coming back for filler.
You speak of the regenerative options. What are those? I think we're hearing a lot about different facials and injectables at the moment, especially on the TV and everything. What can we be doing to rejuvenate the skin, but also the eye area?
Yeah, so regenerative treatments is really taking off at the moment, which is great. I think it's brilliant. And essentially what they do is they give you that instant rejuvenation. Some of them do, but they also help to repair the cells. So you're repairing the age-related changes at a cellular level, and it's more of a process. And there's lots of options. Probably the one that's most established is PRP, which is platelet-rich plasma, where you extract some blood, and you purify it down and you extract the growth factors and you can inject that. And that has a great role around the eyes because it doesn't clog up the lymphatic system, so it's suitable for everyone. And it can really help with dark circles because it can improve the circulation. So that's probably the most established one. And then there's some new ones, polynucleotides, not that new. That's also been around in medicine for decades, but new in the sense it's started to really take off. And it's a great option for the eyes, again, because it won't clog up the lymphatic system. And I've used polynucleotides in many patients with fat grafting previously in the under eye area, filler in, and you don't get the swelling, patients with malar edema. So it's a great option to improve skin quality, but it's just understanding the role of what they do. And I think there's a lot more products still to come now on the market in the future.
I think it's really interesting that we're taking this regenerative approach, using our own body's resources to rejuvenate what we're looking like.
Definitely.
And when we aren't looking for non-surgical, but in fact wanting to go down the surgical route, what are the options?
So blepharoplasty surgery, and that's my main area of expertise. Blepharon is from a Greek term that means eyelid, and plasty means to mould. So you're essentially moulding eyelid skin. And in the upper lids, the most common concern is excess upper eyelid skin, and the medical term's dermatochalasis. And the skin can be so severe that it actually sits on your lashes or can even start to affect your vision, particularly on the outer aspect. The lower lids, there's lots of other concerns for lower lid blepharoplasty, the puffiness, excess skin, or any hollowing. So modern techniques for lower lid blepharoplasty, we actually reposition your natural fat. So we reposition the eye bags into a groove, and that can rejuvenate the appearance.
Wow. And they're not just aesthetic treatments, are they? They're functional as well. Isn't this something that you were offering on the NHS before you went to aesthetic practice?
Yeah, absolutely. When I first started as an ophthalmologist in 2011, my first ever blepharoplasty, it was on the NHS. But unfortunately, it was taken off the NHS because it doesn't affect your eyesight. So it was then now in the realm of the cosmetic sector. But it is a great operation. It's safe, minimal downtime, and it really can make such an impact on the face.
I'd love to ask about the safety, actually, because I can be a bit of a skeptic. Is it safe to be having this? It's so close to the eye, it could seem almost dangerous.
Yeah, and that is actually a common concern that all patients have. But really, wrist to eyesight is very rare in experienced hands. Actually, the number is 1 in 22,000. So that's essentially zero. And actually, a fun fact that I think we've spoken about before, the risk of affecting your eyesight being a contact lens wearer is actually 1 in 1,500. So when you put that into perspective, actually, blepharoplasty is very safe.
And when it comes to sleep, we touched on it briefly earlier, is it affecting the way that our eyes look? Is it giving us dark circles? And what can we be doing to change that if we are experiencing that?
Yeah, so sleep in the eyes is really interesting. I think there's 2 big factors here. There's the actual physiological changes that happen, and then there's the emotional changes that happen. So physiologically, what happens to the eyes if we don't get enough sleep? So overnight, your skin repairs itself. If you're not getting enough sleep, you can get water retention around the eyes and cause puffiness. It can worsen dry eye. So in between our eyelashes, we have specialist glands called meibomian glands, and they secrete the oily layer of our tear film. And the tear film, the ocular surface, is actually really important because if you think how we see and how we process images, light has to go all the way through our eye, to the back of the eye, to the nerve, up to the brain for us to see. So the first point of contact of light is the ocular surface. So you've got to really look after it. So when you're sleeping at night, what happens is those meibomian glands are secreting oils, your ocular surface is resting, and it's being repaired overnight. So if you're not getting enough sleep, you can get dry eye. That's why people say they look a bit bleary-eyed, because when your eyes are dry, your eyes go red. And the eye can be watery, gritty, foreign body sensations. There's lots of symptoms that can actually happen. Also, when you're sleeping, that muscle I said that's responsible for blinking, that very busy muscle, isn't getting its rest either. So sometimes you can get flickering of the upper eyelid, which is quite a common concern that I think most people have had. And it's usually due to lack of sleep, and there are other reasons as well. And then there's also the emotional side as well. A common concern that patients always say is, I look tired. It's the first thing they say. And it can be for 2 reasons. Either they can say, I look tired, but I had a great night's sleep. What can you do? And then it's the changes we've already spoken about. Or they say, I actually look really tired and I feel tired and I'm not sleeping. And they can complain of those changes. But I think it's really important, actually, from the emotional side, to look at pictures, because what you often find is if you were to look at a picture, say, from one day to the next, maybe there hasn't been that much of a change. It's just a feeling of looking more tired. Which is quite interesting.
Yeah, it's psychological. And eye masks. Should we be wearing eye masks to sleep at night? Because I love an eye mask, but is it good for our eyes? My eyelashes often feel squished.
That's the thing. I think. I think a silk pillow is good because that's good for your skin in general. An eye mask, I don't really see the need because you don't want to be putting undue pressure on your eyelids. You want your eyes to rest. The skin is so delicate, so I'm not really a fan of eye masks overnight. And like I said, they squish your eyelashes. You don't want that. You've got those glands. You want to get working. You want to be resting your muscles. But on the other hand, if it helps you block out the light, so you don't have blackout blinds, or you're doing night shifts and you want to sleep in the day, then I think it has a role.
And when it comes to allergies, because we're entering, or obviously almost now in allergy season, what can we be doing to protect our eyes, especially for those of us suffering with hay fever?
Yeah, so allergy is definitely hay fever season. I'm suffering a bit as well. So the easiest thing you can do is just buy some lubricating eye drops over the counter. Anything that's preservative-free. Often they contain hyaluronic acid as well. That's really easy to do. And you just can put that in your eye 2-3 times a day. That will provide instant relief, but it will also wash out the allergen, which is pollen. Then you can take tablets like oral antihistamines, non-drowsy ones over the counter. And if it's really not enough and you're still having redness, watery eyes, puffy eyes, then a specialist, an ophthalmologist, we can prescribe a couple of drops. So either an antihistamine eye drop or a steroid drop if necessary, and that will see you through the season.
You mentioned hyaluronic acid there. Would you be able to tell us briefly what that is? Because I think we hear a lot about it, but we may not be aware.
So hyaluronic acid is a naturally occurring substance that's in our skin, and it tracks water. And it gives our skin its plumpness. And it's actually the mainstay of most artificial tears that go in the eye as well, because it's very hydrating.
And you mentioned skin health. I'd love to touch on that as well, because I think you see a lot of that in your practice. What can we be doing to optimise our skin when we're feeling tired and needing to feel stronger?
Yeah, so I think we spoke about this, that after patients rejuvenate their eyes and their eyes are looking great, naturally your eyes then start to look at the rest of your face, think, oh, what else can I do? And the common theme is really, most of my patients who find me for eye rejuvenation aren't looking for a big change. They're a different set of patients to the facelift patients who want to look drastically different. Eye patients want to look fresh, rested, like they've just come back from a nice holiday. So often we will then talk about skin health. So the better quality your facial skin's in, the more fresh and rejuvenate you'll look to match the eyes, rather than doing more aggressive treatments with filler or other types of treatments. So really it's skin health. So we've said the skin boosters, the regenerative treatments, Profilo, the polylactic acid, all of those treatments are great options after a blepharoplasty to rejuvenate the face and neck.
I love what you say there about the eyes connoting that emotion. I feel like it's the first thing we all look at when we see each other. It's such an important part of the face.
Yeah.
Just finally, what are skin boosters?
Skin boosters, so there's lots of them, but what they do is most of them stimulate your own skin to make more hyaluronic acid. As we've said, that improves the hydration and the moisture in the skin. So Profilo is probably the most popular one, and essentially you're just injecting hyaluronic acid in the layer you make it, and then studies have shown that that would improve hydration and actually stimulate more hyaluronic acid to be made, so it's a great option. There's other ones such as PRP, the regenerative ones. PRP, polynucleotides, can be used all over the face and neck. And then polylactic acid is probably the strongest one on the market. And then the best one is using your own fat, which is something I've implemented into my practice as well. But that's obviously surgery.
Amazing. Thank you so much, Elizabeth. That was
Thank you.
fascinating. Thank you so much. If anyone's got any questions for Elizabeth, we'll come back at the end. Flo, moving on to the body now. I'm fascinated by the work that you do, because it's not just healing from injuries or once we're injured, but it's also that preventative approach that you mentioned. Could you just explain who your patients are and what they're coming to your clinic for?
Yeah, completely. So I think over the years we've seen a real change. Firstly, it used to be everyone just saw the physio when they got an injury and very much in a state of help, what do we do? But we're now seeing this shift very much in terms of that preventative piece. But I think it's such an overwhelming subject at the moment, especially when we've got things coming from all angles in terms of, what do we do? How do we prevent these injuries from happening? We definitely can't completely eradicate injuries. They happen to each and every one of us. 80% of us at some point in our life will experience lower back pain or feel neck tension from stress. And I think especially these days, but particularly in London, we're really noticing this kind of high functioning stress. And as a result of that, we're experiencing kind of aches and pains and not quite knowing kind of how to manage our body. So certainly I'm always a kind of go-to when it comes to someone saying, help, I've got an injury, or you'll get consultants, orthopedic or sports doctors really referring to you for that. But then also you've got this kind of real kind of percentage of people coming in with, they haven't got anything and they're saying, how do I improve my posture? I've read this piece of information, and particularly in the wellness and health space at the moment, we're kind of constantly being bombarded with stats and different bits and pieces of equipment that you can buy to kind of help you to improve your posture at home. So I really kind of with that really take people back to basics and, really kind of deconstruct each individual person, because I think the thing is we're also brilliantly different, and that's how I help people.
I love what you say there about overwhelm, but also this personalised approach that you're taking in clinic. What techniques do you use? What can we expect if we step into your clinic?
Yeah, completely. So very much it depends on the individual and what they're coming in for. So very much a snapshot will be, traditionally people come in firstly and they may have an injury, so they're wanting some advice and information on how they can improve that. And I think sometimes physio can get a bit of a bad rep. It's, I went to my physio, they just gave me some exercises and it's not better. So it's really kind of scaling things back and looking at firstly the diagnostics. Do they just need to be seeing me, or do we need to get a doctor involved to do onward scanning or give kind of advice with regards to pain relief, etc. But I think the core fundamentals is really looking at how someone's moving, but, really an in-depth assessment of how they're moving. So, for example, when we're looking at how someone squats, are they utilising the correct muscles to be able to do that? And are we kind of using accessory muscles and clenching our jaw and holding our breath? And is our nervous system really interplaying with that and feeding that pain? I'm also really, really interested, particularly with sleep. So one of my first questions to someone will be, how are they sleeping? Looking at the nutrition also. And I think also, with that, protein has such a big impact with regards to load and strength training. And we notice with strength training, particularly as we age, and I hate bringing age into it because people think, oh, I'm getting older, I've got those aches and pains. But age is just one thing, yes, but we do notice with that a steady decline, particularly with our testosterone in males and estrogen in females. And we're really kind of wanting to give everyone the support to firstly think about that preventative piece and help with injury as well.
Is there a certain point in life that we should be coming to see you if we're not feeling those aches and pains already, but just building the strength so that it doesn't deteriorate over time?
I think it's one of these things as such, because you sometimes, if someone's coming to see you for that preventative piece, you don't want to cause overwhelm. Because, we all move, we all can sit to stand, and we might look in a mirror and think, oh gosh, my posture's awful. I'm a physio, and my posture occasionally needs improvement.
We all sit up.
But we're all beautifully independent, and I think it's very much if someone is having difficulty with sit to stand or climbing the stairs and just noticing a slight ache, that's when people kind of reach out to me. But I think more and more with people being invested in their health, they are coming to me saying, oh, someone's mentioned my shoulders, I'm holding tension, or I read somewhere that, I need to be moving. How do I go about that? And I think, there's so much of that longevity piece at the moment in the press. And yes, the word longevity, means something different to each person. But for me, fundamentally, coming from a kind of, yes, we take into account the nervous system and, how we're kind of holding ourselves. But from a physiotherapy perspective, it's very much kind of saying, okay, well, how is someone, how are they moving? How is their bone health? How is their strength and nervous system as well?
You speak about longevity there and also bone health. Are there different stages of our lives that we should be seeing you? I know that there's males and females in this room, which is lovely to see, but especially as females going through that perimenopause and menopause stage, is that a time that we should be thinking more about our strength?
100%, and it's not only so basically as we get older, we notice changes in our estrogen levels from the age of 30 more significantly when we are 40 years old, and for females particularly, that with reduction in estrogen, we see it much more quickly and dramatically with a drop off when we enter particularly that menopause phase. With males, it tends to be much more of a slow process, so they won't notice it as much, but particularly with their training, they may kind of see, spaces where they're kind of having to really kind of think about that recovery phase. But I think kind of particularly for females, there's such a kind of big importance around strength and also bone health. So we're seeing a lot more, particularly recently with rises in osteopenia, which is the kind of pre-warning sign for osteoporosis. But I think we see notably with the rise in exercise classes, particularly like Pilates, which are fantastic for thinking about posture and how we hold ourselves, there needs to be much more of an emphasis around strength. So we should be really loading, and I use this kind of percentage quite loosely because I think we're all so different, and it doesn't mean go tomorrow to the gym and suddenly load a heavy amount of weight, because you need to have that awareness of how to do it. But we should be loading around on a rough, summarizing guidance. It's incredibly different for each person, but around 60% of our body weight. Now, when someone's coming to you and they've got shoulder pain and they're going to Pilates class, which is fantastic, they're learning how to move and how to hold themselves, but they're lifting a low 0.51 kg weight. We're having to really test that from a physiotherapy perspective now to think about, muscle health, bone health, and particularly at the moment with it being just such a buzz topic.
You mentioned the personalised approach. What role does testing play in your clinic? How can we know if we're heading in that direction of things like osteoporosis or problems like that?
Completely. So I think in this day and age, there's a lot of tech involved, and it's certainly coming into clinics. And we've got kind of various assessment toolkits that we can use. There's some incredible AI pieces being created at the moment, which is absolutely amazing from not only a nervous system kind of feedback approach and how well we're kind of calming ourselves, but also, by using kind of various markers on your body to show how one is squatting or, moving the neck in different range or shoulder range. I think we can go too incredibly detailed with the data, and particularly for kind of the day-to-day person, they might not be as interested or might find it's very much overwhelming. So we will start off with very much basics in an assessment, and again, it depends on what the person's coming in for. But we would very much kind of get in the gym and be looking in a mirror and, really increasing a person's awareness around how they're moving. So, an assessment firstly might be looking at, how someone's squatting, what's the difference between the left and the right. And quite commonly we can see quite amazing kind of 40% differences between the left and the right. And that's where we start to think about, okay, well, if someone has got those differences, how we can give them things to be doing at home, but then also, do we introduce them to a coach, a personal trainer, and just increasing that awareness, and then going from there.
It comes back to the awareness of our own bodies. I love what you mentioned there. When it comes to other techniques that you use, I know that you use acupuncture and alike. What role is that playing when we really wanted to build strength but also calm the nervous system, like you mentioned? Yeah,
so there's an incredible balance with building strength, and certainly whenever we're doing something that builds strength, it creates a level of nervous tension. So we've also got to look at that balance of creating that stress and tension with then making sure that the nervous system is nice and calm. And it almost, we're never at a perfect equilibrium with that. And I'm certainly sure you will touch on that a lot. And I guess it kind of roots back to that piece that in the we've got to consider the environment that we all live in at the moment, and certainly if we look at the news each day, there's kind of more and more stress in the world, and also people's workplace, their sleep is all kind of impacting upon stress. So very much from my perspective, part of I'm very hands-on as a physio. I think there's a lot of kind of hands-off practitioners around there, and that's absolutely fine because some people's kind of forte will be in a gym and going through kind of strength and conditioning program with people, but I very much kind of see that the nervous system has such an impact on our stress levels and therefore our pain. So when someone comes into the clinic, there's, you can get a lot of kind of feedback with how the body feels. So we would be looking at kind of, how someone is holding tension, and then utilizing acupuncture as something of nervous system regulation. So, it's not only, I've spoken a lot about strength today because it's such I think, an important topic when it comes to load, but anything that kind of can focus on nervous system regulation, and making someone more aware of that calm. And I think it's only when they step into that calm do they realize, oh gosh, I've not been sleeping. I'm getting 2 hours sleep a night. My breathing is completely all over the show. My back pain's not improving. Help. And certainly, just to kind of almost add to that and slightly flip to a different subject, we're really seeing at the moment people kind of coming in who've got quite kind of mild presentations when we think about the kind of complexities of what people can present with. But there's very much a fear surrounding, that ailment, and almost this sense of failure that my body's not strong. What have I done to myself? Oh my goodness! And this almost like cascade of overthinking, and I've got to get an MRI scan, and very constantly talking to doctors. saying, oh, I've got this client, they don't actually need to see you, but we want to see you for reassurance purposes.
How do you coach your clients through that? Because I think that's something we all probably experience, overwhelm and fear. How do you coach your patients through that?
100%. I think some of my clients who are in this room today would probably say I am sickeningly positive, but very much giving kind of support from a statistical perspective and, giving someone realistic goals of what to expect in each stage of an injury. I think also with it's very much that teaching point. Getting someone to learn about their body is so incredibly important, because if you become, with the hands-on bits and pieces, you do run that risk of becoming very passive and all they, become reliant on you. So it's equipping someone to, just kind of keep an eye on their sleep and move a little bit more and keep everything really quite simple. And again, people will get their information from lots of different areas. So I always say to someone, if they're coming in to see me, just focus on, what, obviously building that trust, but focus on what I'm saying, and then don't speak to Team Google or their clients at work to get that information, and because it's just this, oh my goodness, this overwhelm again, which again, we're trying to kind of calm that nervous system to help.
And it's about understanding how resilient our bodies are as well, right? Like, I think we are more resilient than we think we are. Sometimes we just think that there's always a problem.
100%.
And what role do you see tech playing in this, like at-home wearables? I know that you've mentioned AI, but also overwhelm. I think there's this balance to be struck of seeing our data about our own bodies and testing for that, but also taking a step back and not getting too stressed about it.
Completely. I think that particularly Whoop have just announced some new tech this week, and it's absolutely fascinating. But it's just utilizing it to understand your body that little bit more, but not relying on it. So, if you wake up and Whoop, when I've worn it before, tells me I've had an awful sleep and I'm in the red and I need to completely change my day as a consequence. But I think it's, again, that piece of overwhelm that I'm a little bit concerned with at the moment. There's just so much data out there, and it's like how to put it all together. I've got particular clients that will be wearing a Whoop, an Oura Ring, an Apple Watch, and a heart rate monitor all at the same time. And it's kind of almost saying to them, hang on a second, we've got to take that away. And people can become too reliant in it and feed their day with, okay, my Whoop says I'm in the red, right? Oh gosh, I really need to focus on my sleep today and calming, which is incredible. But I think it's actually, okay, well, really kind of going into that kind of conscious awareness builds our subconscious competencies. So having that conscious awareness of how you're feeling, how you're moving, how your walking is that day. Is your breathing laboured? Are you holding your shoulders like this, which really affects our breathing? And using those different bits and pieces. But I think my overriding thing with people is really stripping back to basics.
Are there 3 things that we can do from home to achieve that, whether that's building strength exercises, some relaxation that you recommend?
100%. Well, I'll tap into the relaxation. I think there's something beautiful with relaxation about getting out into nature. I think just switching off all devices, not even listening to podcasts when you're out and about walking, but just using that time to really kind of calm yourself down at the end of the day. So the kind of nature would be number 1 from a nervous system regulation perspective. Number 2 from a movement strength perspective is actually introducing some kind of light body weight pieces. How do you squat? How do you go up into your tiptoes? How is your balance? Balance is such an important part, particularly as we age. The risk of falls after 65 is tremendous, and one of the sadly leading causes of death when it comes to musculoskeletal cases, is one side different to the other, particularly with females. Heavy handbags, is one shoulder, slanted, and it doesn't mean initially kind of lifting heavy weights, but starting to load with some weight, certainly, because we all, we all lifting heavy shopping bags. People are always saying, "Oh, I'm fearful of getting bulky when I'm, completing weights." It's incredibly difficult to do. So, it might be kind of lifting a weight whilst doing some sit to stance, holding, a weight, being careful on stairs, but holding a weight climbing the stairs, just to challenge our nervous system, but not over-challenge that it, affects us, causes more stress.
Thank you so much, Flo. That was fascinating. I love this idea of not feeling overwhelmed, which I think we all do. Finally, Jamie, on that note.
Hi.
We'll shortly dive into breathwork and its impact on the nervous system. But I think first, if everyone would like to join, we're going to do a very grounding breath just to center us all into this moment.
Absolutely. So I'm just going to invite everybody to sit comfortably. And if you feel comfortable doing so, just gently closing your eyes. And this is as much for me as it is for you. So just start to settle into the body. Been sat here a little while now, so notice how the body feels. And in these first couple of moments, just notice, what is your experience of stillness? Can you notice the subtle sensations of the body? Any areas of relaxation? Any areas of tension? Noticing also your experience of the mind. Are there few thoughts, many thoughts, quiet mind, busy mind? And also tuning into your energy state. Do you feel light? Do you feel heavy? Open, closed? And now turning your awareness to your breath. Beginning to connect to that natural, ever-present rhythm of your breath. And avoiding that sneaking temptation to control the breath, can you simply follow it from the beginning of the inhale all the way through to the end of the next exhale? And on your next breath, begin to take a little bit more control over it. Begin to slow the breath down, breathing in and out of your nose. Breathe deeply. Breathe slowly. Feel the belly rise and expand as you inhale. And allow it to softly, gently fall as you exhale. Taking one more full cycle of that breath in and out of the nose as slowly as you can. And then from here, we'll take 3 cycles of an extended exhale breath. So inhaling gently, deeply through the nose. This time blowing the exhale back out through the mouth like you're blowing through a small straw. Extending that out breath, letting everything go. Feeling the whole body soften as you reach the end of that exhale, taking your next inhale. Extending that out breath again. One more like that, last one. As you reach the end of that exhale, allow the breath to come back to center, back to its natural rhythm. Just as we started with, notice the body. Notice the mind. Notice your energy. And then just gently inviting in some micro movements, wiggling the toes, wiggling the fingers. And whenever you're ready, blinking open the eyes, coming back into the room. I didn't hear any snoring. I think we're good.
No one's asleep. Wow. I need to get back to my questions.
Welcome back.
That's brilliant. And that is just a small part of what you do. I'd love if you could start explaining what is breath work.
For sure. I think it's always beautiful to start with something like that, because that is it. And I can talk for days on this stuff, but I always like to get through that part fairly quickly, because it allows people to really dive into the direct experience of what it's all about. But you have asked me a question, so I will answer. Breathwork for me has always been an umbrella term. It's a catch-all. It's any way that we can use our breath to shift our state on the physical, the mental, emotional, the spiritual, and anything in between. Within that, my personal experience and journey with breathwork took kind of three distinct paths that have a lot of crossover, but kind of three distinct pillars that I like to speak to within breathwork. The first is all about functional breathing. So this is about how do you breathe day to day, moment to moment? What is that natural resting state of your breath, the 20 to 30,000 breaths that you take every single day? What is that doing for you? What is that feedback loop? How is that impacting how you think, feel, operate, and exist in the world? The second pillar is all about the nervous system and nervous system regulation. So how can we use the breath as a tool to influence the state of our nervous system? And that can take many different forms. We can upregulate the nervous system. We can downregulate the nervous system. We can shift it in a whole manner of ways. And I think that's what most people with the rise of breathwork now associate with breathwork. It's the box breathing. It's the extended exhale breathing. It's the 3, 5, 10, 20 minutes of a specific exercise or sequence of exercises. And that's incredibly powerful. And then we have this third and final pillar of breathwork that is really the therapeutic healing modalities of breathwork, where we step into the world of the more trauma-informed, slightly more spiritually led practices of breathwork. It's probably where I spend the majority of my kind of time and work in retreats and workshops. And I love talking about this stuff because I think it's been confined to the realms of like the deep spiritual. And that's why I was so skeptical of it for such a long time, because I was like, it feels too much. It feels too far down the rabbit hole. But the more I've experienced it, first experienced it about 8 years ago, and the more that I've facilitated it, the more that I understand it as well. It's such a powerful healing tool in the way that it can give us access to these mystical, spiritual, and non-ordinary states of consciousness. And for a very long time, there's been very little research on this particular end of the breathwork spectrum. But there's one study that I always like to cite that came out about 18 months ago that found that something called conscious connected breathing, which is one of these particular modalities, can create mystical and transcendent experiences on par with medium to high doses of psilocybin, which is the active ingredient in magic mushrooms. And so we've seen so much excitement and funding and talk around the therapeutic applications of things like psilocybin and psychedelics, and yet we've kind of jumped over the breath as a legal, accessible, powerful option to tap into these expanded states.
I love the way you speak about the breath, because I remember when I first started breath work, everyone would say, but we're all breathing, we're doing that every day. But you really come out with the science, and it makes me understand breath work deeper. Who are the people that are coming to see you? What are they looking to achieve when they're coming to your classes?
It's, a very good question. I think what they think they're coming to me with is stress, anxiety, insomnia, kind of the usual suspects of the modern world. Then we start talking about it. And those are really kind of the presenting symptoms of something I think that often goes a little bit deeper than that. I mentioned when I introduced myself kind of these three kind of pillars of my work of awareness, autonomy, and purpose. And for me, those match up to kind of this trifecta of modern misery, which is kind of disembodiment and disconnection from ourselves, but also from the physical, which kind of marries up to the awareness piece. Then sort of societal level, nervous system dysregulation. We're out of balance, we're out of autonomy, we are stressed, anxious, and overwhelmed. And then the third one is about meaning and purpose. And so we've seen in the modern world this sort of falling away for some good reasons and some less good reasons of traditional religion and kind of traditional meaning structures, And everyone is lost as a result. We're kind of very trapped in the 6 inches in front of our face, trapped in our heads, and wondering what it all means. And these deeper experiences that I spoke to with conscious connected breathing can help connect us to that. And so I'd say people are showing up with stress, anxiety, kind of nervous system pieces, but often, and this was actually my personal route into breathwork as well, I was just so deeply disconnected from myself at a fundamental level that I was getting a whole range of symptoms as a result of that, and breath really was able to take me back to myself and resolve a lot of that.
How can we expect to feel during a class?
Depends on the class, and I think that's why I love conversations like this, because I view a large part of my role as kind of an educator to help people, as you very kindly spoke to, kind of understand what it is beyond simply breathing. And so I'd say we can put it into a few different camps. We'll go 3 different camps. The first would be a snapshot of what we just experienced, which is about calming and settling the nervous system, or down-regulating the nervous system. And during that, you might fall asleep. You might just feel really gently calmed. Or you might feel agitated because you're not used to sitting still. And that's the other thing I see show up a lot. Then we have the, I suppose, internal accelerator pedal of the nervous system, where we start to upregulate and add activation and energy into the system. That could be very simply to help us feel more charged up, more energized, more focused, but also when people are presenting with lethargy, low mood, more of like a free state within the nervous system, we might help them by adding a little bit more energy into the system rather than taking it away. And then, again, coming back to that deeper end of breath work, that can take so many different forms. It can be a very cathartic emotional experience. It can be a borderline psychedelic experience. It can be a very calm meditative experience. But I'd say for the majority of people, that experience just really roots them back in their body. I think we all, myself included, underestimate how much time we spend stuck in our heads. And I think just to actually move your body and breathe in a certain way to feel something on a very visceral level just is an underrated but very powerful tool nowadays.
I love what you say there about using it not just to downregulate our nervous system, but also to make us feel more energized. What is happening in the body and the mind when we are doing breath work?
Yeah, again, sort of depends what we're aiming for and the intention of what we're looking to create. But I mentioned there kind of these 2 branches. We've got our down-regulating practice or our up-regulating practice, and we would tap into those at different times for different reasons. And it really comes back to, I'd say, the most fundamental piece of breath science that I would love everyone to take away from this, which is just the role of the breath within the nervous system. You know, we hear a lot about nervous system regulation this, nervous system regulation that, but why is the breath so often touted as such a powerful tool for it? And the reason for that is that the breath is part of our autonomic nervous system, which governs all of our automatic functioning, of which the breath is a part. But the breath is unique within that system because it's the only part that can be consciously controlled. And so essentially we have this little remote control through conscious breathing to shift the state of the autonomic nervous system. And the reason that the autonomic nervous system matters is that it governs our stress response. So that's really kind of the loop there. But when we work with the breath, depending in which direction we're going, we're essentially just directing signals back to the nervous system to create that shift and create that change. But in terms of the benefits, we can see impacts on cognitive function, impacts on blood pressure, heart rate variability, which your clever wearables will track, sleep quality, hydration, sports performance and endurance, life satisfaction, mood. There's a whole range of different benefits.
And what does a regulated nervous system look like?
I find myself saying it depends far too much. I'll tell you what it doesn't look like. I think that's a nice place to start. I think the misnomer around nervous system regulation is that when you are regulated, it is this permanent end destination of always being calm, of always being zen. I think that's probably one of the biggest misconceptions about me, is that I'm always calm. So it's not a permanent destination of calm. It's about having the capacity to navigate and handle and hold the inevitable stresses of life. And when we do find ourselves in a more dysregulated place, when I'm a bit anxious, when I'm a bit angry, when I'm a bit activated, how well and how quickly do I return to baseline? And so I always like to say that your nervous system is the lens through which you experience the world. It's the glasses that you wear to experience every aspect of your life. And so what that then shows up as when we do fall into that state of regulation is really just the best expression of yourself. When you are in that regulated state, for me, I know if I'm dysregulated, I don't have any creativity, no ideas, nothing. When I'm regulated, I'm irritable with the number of ideas that I have. And so I think it's just about understanding that the goal of nervous system regulation isn't nervous system regulation, it's how it makes you feel and what shows up for you as an individual as a result of that.
It's really interesting because I think that goes back to what Flo was saying about trusting ourselves and knowing that we are actually resilient and leaning on ourselves. Are there different types of breath work that we can be doing, or anything that we can be doing from home and not just in your classes?
Yeah, absolutely. So I always say to all of my clients, you can come and see me once a week for a year, but actually you probably get a lot more done if you're doing 10 to 20 minutes a day at home and seeing me once a month. Obviously building that habit sometimes takes a little bit of time and practice, but a daily practice when it comes to nervous system regulation is kind of the gold standard of what we're aiming for. 2 layers to this is, first, I think the most important piece comes back to awareness, is being able to tune in and connect your body and the sensations of the body and your nervous system to understand where you're starting from. So to Flo's point again, being able to meet people, but also meet yourself where you're at. And to do that, we have to understand where we're at. And so understanding, for me, for example, as a kind of guinea pig for this, in times of high stress, high strain, I sort of go up into more agitated, sort of high activation. But if that then continues for a long period of time, I can crash and dissociate and go more into a stuck, freeze, kind of lethargy state. The application of breath work would be different for that based on where you go and how you feel. But very simply, if you are feeling that high end of the arousal spectrum of anxiety, of panic, of stress, of overwhelm, then slowing things down, that extended exhale breath that we did at the start, gentle nasal breathing, box breathing, kind of anything that is reducing your respiratory rate.
Can you explain what box breathing is? I think it's a really powerful technique.
Or maybe we talk about triangle breathing. We could do that instead. Box breathing and triangle breathing, really just a kind of diagram of how you breathe. So box breathing would be 4 equal parts. It would be an equal part inhale, hold, exhale, hold, usually all through the nose. Mostly people would start with 4 seconds per side. Triangle breathing, which does actually exist, you just take out the final hold, so it'd be in, hold, out. The goal of that, if you think about breathing at kind of 4-second sides of that box, is 16 breaths per round, about 4 breaths per minute. The average respiratory rate of an adult is 12 to 18 breaths a minute. So you're massively reducing your breathing rate, which is just sending that kind of signal of calm back to the nervous system.
Is it quite normal to feel lightheaded? I know when I first started breath work, I used to feel lightheaded and almost like I shouldn't be feeling that way.
It's something that comes up quite a lot. I think usually what I see creating that is twofold. Well, kind of they're one and the same, but that reduction, for example, in the breathing rate quite significantly. Most people would say, I'm feeling lightheaded. Does it mean I'm not getting enough oxygen? No, you have enough oxygen, you're fine. What it actually is coming from is a rise in carbon dioxide in your system. So you're subtly increasing ever so slightly levels of CO2 in your system, which can create a feeling of slight lightheadedness, can occasionally create a slight feeling of kind of panic and anxiety. So yeah, if anybody does experience that with things that should be calming you down, then it's usually kind of a physiological reason.
And what are the supplementary therapies that we can be doing alongside breathwork? I know you're a huge fan of things like contrast therapy, because I've seen you at ARC once before, and like penf mats, red light. What do you advocate for alongside breathwork?
I'm team Flo on this one. Less is more. I've stripped out so much bullshit from my wellness habits and routines. I do have a red light, and I love a bit of red light. I have a PEMF, that mat that I will sit on when I'm doing my breathwork or meditation in the morning. But time in nature, we spoke about, I think, pace management, which is just a bit of jargon that I invented when we were on that call. But really, it's about living a life that facilitates and supports nervous system regulation. It's environment design. It's spending time in nature. It is breaking up your day with micro resets so that you don't just switch on at 7 a.m., over caffeinate, go for it all day, go to your HIIT class, come home and expect to sleep well. I think that's one of the things I see so much in my practice is somebody showing up with stress and anxiety and overwhelm, and they want something, they want support, and we start talking about their lifestyle, and I go, oh, it's probably the 4 coffees, 2 HIIT classes, screen time, overwork, the lifestyles that most of us are living, myself included. I have to really catch myself because the odds are stacked against us as far as the pace of life, particularly in cities. And so pace management is probably the single biggest thing that I try and encourage people to do. And the breath kind of acts as a handbrake or a foot brake to create those micro pauses and micro resets. But yeah, things like contrast therapy, exercise, I think underrated is time and community. We're incredibly individualistic and isolated in our wellness journeys very often, and it's great to see experiences like this, in-person experiences, run clubs, yoga classes, workshops, whatever it might be, actually getting together with people. I know from my Whoop that the time that my HRV, which is the best metric and measure that we have for nervous system regulation, the time it jumps the highest is when I've spent a really wholesome day with a great group of friends. It's not the tech, it's not the ice bath, it's actually spending good time with good people and laughing and having fun and playing. And so social I think well-being. That's, social wellness, but not contrived, I think is the important piece.
It's so true. And as a leader in this field, what are you excited about? You spoke at the beginning there about the impact of breathwork actually being able to take us to places that only before psychedelics have been able to. What's exciting you in the industry at the moment?
That's probably the biggest piece that excites me. Back in January, I gave a talk to the psychedelic research team at Imperial College, which is one of the biggest psychedelic research centers in the world. And just the fact that I was there, speaking to one of the most prominent psychedelic researchers in the world and having a legitimate conversation where he's listening to what I have to say was a bit of a moment for me, and just a really compelling case for where this can go, especially as it starts to enter the mainstream. As I said, I think it's been very fringe for a very long time. The first Western schools of this particular kind of breathwork, they have ancient roots, but the first Western schools were created in the 70s. So this stuff's been around for a decent amount of time. My brain wants to tell me 30 years because the 70s were 30 years ago. But yeah, 50 plus years. And so more of that is definitely going to be coming around. The other thing that really excites me and that I'm sort of pushing, as I kind of alluded to, is the in-person piece. Offline, my last 2 events have been phone-free. Terrible for socials and marketing, but great for the experience. This rise of intentional de-optimization, I said for myself and for a lot of the people I work with, we're stripping things out, we're subtracting rather than adding. And I think we're only going to see more of that. We have all spent, and I think it's an inevitable part of the life cycle of personal development, is we add a load of stuff in, we see what works, and we keep what works, and we get rid of everything else. If something doesn't work for you, just because TikTok told you it would snatch your jawline or make you feel amazing in some way, it can go, as far as I'm concerned, because there's the Lululemon report that came out earlier this year that like 52% of people are experiencing well-being burnout, which is just the height of irony. And so I think that's something that I'm encouraging and there's a level of irony kind of being within the industry because I'm arguably as much part of the problem as the solution, but I really try to lean towards saying, if you don't need this or if it doesn't work for you, then please go elsewhere. And this flip and this inversion, I think, of moving beyond sort of healing and wellness as an identity to actually living first with your wellness things to support. What I always say for myself is my intention is to live an interesting and fulfilling life, and that's my hope for everybody else as well.
That's a really beautiful note to end on. I'm fully inspired. I think you're right. It's the irony, and actually the irony of us all being sat here and having these conversations with so much information. But you've all touched on something really important, which is learning to trust yourself and taking what you need, relying on your body, because ultimately it is extremely resilient, and we should pick and choose the information that works for us in a personalised manner. Thank you all so much. I have learned a lot, and I hope that you all have too. We have got a short time for questions. If anybody does have a question, there is a mic roaming around.
I'm just wondering, in terms of treating eye area for women in menopause or perimenopause, do you change your techniques or advise different treatments, for example, somebody who's on HRT and progesterone increasing, water retention, potentially around the eyes, I'm not sure, and then people who aren't on HRT.
That's a great question, actually. Thank you. So many of my patients are menopausal. So the average age for an upper eyelid blepharoplasty is 45, and lower is more in your 50s because of the non-surgical options. So what's interesting about menopause is after about the age of 30, like Flo, you were describing some of the changes that happen, but within the skin, you start to lose your collagen levels by about 1%. That declines year on year. And collagen is really important to give skin its tightness and its texture. But actually, when you go through the menopause, you drastically drop your collagen levels by 20% over 5 years. So often, many women will say, I feel like I've aged overnight. Even though it doesn't happen like that, it can feel quite drastic. So really, when you get when you're going through the menopause, in terms of changing techniques, but it's not so much that. It's more you'd be looking more at surgical options and the regenerative treatments as well, which you may even want to preempt and start doing in your late 30s, just to really build up a bank of collagen to sort of delay the onset of fine lines and puffiness and excess skin. Yeah. Oh, yeah, that's a great question. So, I mean, the collagen supplements are interesting. I think there is evidence out there, but it's limited. But, you know, anecdotally hearing my patients talk, some patients swear by it. But it is quite difficult for collagen to go all the way through your gut and be metabolized and get to where you need it. But there is some evidence, and many of my patients take collagen supplements, and it's fine with no harmful effects.
Any other questions? Oh, there's one at the front.
I have a question. My friend's husband is a facial surgeon. I'm not quite sure in exact what capacity he is, but he said if you have a blepharoplasty, when you get quite old, like 75, 80 onwards, it can really go in and drag your face back. So have you heard of this, that the future results of having a blepharoplasty that can look great for 20 years, but if you're lucky enough to live into old age, it can start to warp?
Yeah, that's a great question. So it's all about how techniques have changed over the decades of blepharoplasty surgery. So more older school techniques were quite aggressive, where it'd be very aggressive fat muscle removal. Nowadays, it's all about volume preservation, so you don't get that hollow, sunken look in the future. So techniques such as fat repositioning, which is where you actually move your eye bags. So you have to remove a little bit, but mainly you reposition your fat to fill any hollows, you tighten muscles, and you barely remove any skin. So modern techniques prevent that hollow, sunken look that you can get when you're older, and actually can make you look older as well.
This is a question for you, Jamie, on the subject of kind of nervous system regulation, difference between like sympathetic, parasympathetic nervous system. As someone who's kind of feels like I'm constantly in fight or flight, living in daily life in the city, you say 15 to 20 minutes a day. How does one build up to that, and where does one start if they haven't experienced that before?
It's a great question, thank you. What I would say on this one, through the lens of sort of sympathetic activation and that higher end of the activation spectrum, in an ideal world, bookending the day. So I would always say, for me and for everyone that I work with, within the first 30 minutes of waking, I do my practice before I get out of bed. I sit up and I will do 5 minimum, maximum kind of 15, 20 minutes of slow, intentional breathing. That could be one particular technique. It could be as simple as just slowing your breath down in and out of your nose, whatever works best and kind of lands best for your nervous system, which takes a bit of trial and error and practice. I would have said previously when I say bookending just before sleep, but actually I've brought that forward over the course of the last few years to say at the end of the working day or level of exertion. Your face tells me that you work late. Whether that is 6 p.m., 7 p.m., 8 p.m., 9 p.m., at the point at which you are ready to switch off, that would be where I would say put a full stop at the end of the day. The reason for that is in their optimal state, the nervous system switches on when stress is required and switches off when it's not. nervous system dysregulation at its core is when the nervous system loses its capacity to do that. And most of ours have lost the capacity to do that because of lifestyle and the fact that we don't give ourselves that option to kind of switch on and off. So to intentionally put that at the end of the day when you are done allows you to properly rest in the evening, properly recover, and get the best possible quality sleep. On top of that, or within that, I would say those micro resets, kind of what I call breathing breaks. That could be sitting still and taking one deep breath. That could be 3 minutes, 5 minutes, 10 minutes. I say to people, it's in between meetings, it's in between calls, it's in the natural breaks in the day where we might just scroll. We go, okay, maybe I'll scroll, but I'll also be breathing slowly. Like, let's also be realistic with this stuff around how we need to integrate it into busy lives. And I'd say that if you're doing 5 to 10 minutes first thing, 5 to 10 minutes at the end of the day, and maybe 5 1 to 2 minute micro resets through the day, if 80% of the people were doing that 80% of the time, they would feel 80% better. And so I think simple, effective, and achievable. And then wrapping all of that in sort of self-compassion rather than kind of self-loathing, because a lot of our habits are often led by hating ourselves, and actually we miss them and we go, oh, well, I'm a terrible person and I'm back to square one. So I think just being gentle and realistic and keeping it simple.
And Jamie, am I right that you've got a space online where people can do this as well if they're struggling to find a practice?
That's very kind of you. I launched my app about 2 months ago, and we'll work out a way, we haven't discussed this, we'll work out a way for everyone to get a free first month on that so you can go and try it out.
Thank you. I think it can be difficult to guide yourself at first. So if you're someone that's just entering, it's really beneficial to be guided through that.
For me, I still use guided 90% of the time. It just allows you to get out of that heady place of, am I doing this right? What did Jamie say about that thing? All of that crap.
Thank you. And
adding to that, like it's a social connection again, isn't it? Like having some feedback from someone, and it's the same when it comes to classes. Particularly after COVID, we saw people, or doing exercise at home and really kind of, but having something that guides you and, someone talking to you and saying, yes, you're doing that correctly, and that beautiful piece around kind of, those in-person connections as well. Fantastic.
Thank you. For anybody that does want access, I'm sure that we can facilitate that with Soho House, but if you also wanted to pop your email addresses on those cards, we can link with you directly for that. There's one question, and then I know there's one in the right-hand side there, and then we might have to wrap it, but I'm sure they'll stay around for some questions at the end.
Okay. Hi, Elizabeth. Great talk. Thank you very much. Question, what is your perspective on exosomes?
Oh, hi. Thank you. Exosomes. So, again, part of the regenerative space. So currently in the UK anyway, you can't get exosomes from humans. They have to be plant-sourced. And there's definitely a role. But I think we're just sort of waiting for the technology to improve. But essentially, it's understanding what they do. And what they do is they improve skin quality. So it depends what your concern is. If your concern is fine lines, creepy skin, then yes, you want to look at the exosomes, PRP, polynucleotide options. If your problem is actually volume loss, then you may want to look more at fillers. And then if your main issue is puffiness, then you'd be looking at a surgical blepharoplasty.
Thank you. And I think there was one more question just over there.
Hi. Thank you very much for the panel. It was very informative. I have 2 questions, if that's okay.
That's okay.
So first one to Elizabeth. Where do you stand from eyelash serums? Because you said something about the glands producing oil at night and stuff. Because I tried it, and then I started getting some bumps, so I just stopped. And the second question is for Flo. Where do you stand from like mobility online platforms? Because like I'm getting to the age where I can see like a decline a little bit. So I was thinking about like signing up for an online platform. Do you think it's worth seeing a practitioner first, or like how does it all work together? Thank you.
Okay, so thank you for asking that question, actually. Lash growth serums. So I'm not an advocate for them at all. They have quite a lot of unwanted side effects. So the prostaglandin analogues were originally from glaucoma drops. And one of the side effects we saw, so glaucoma is a condition when you have a raised pressure inside the eye. You have a pressure in your eye and then you have a blood pressure. So these drops will lower that, and they are very successful. One of the side effects is you get long lashes. And, it sounds like a great thing, but actually It's not, and it can be quite upsetting for glaucoma patients to have thick lashes that grow in different directions. So then, of course, the cosmetic industry jumped on that and started to use prostaglandin analogues for an aesthetic purposes. But they do have quite a lot of unwanted side effects that we know about. So they can cause atrophy of the fat around the eyes. We were talking earlier about a sunken socket. So prostaglandin use can actually cause the fat around the eye to atrophy and make you look older. It can cause increased pigmentation of the eyelid skin. So it can give you dark circles. It can even turn blue eyes brown if you're using it excessively from the pigmented point of view. And it also can irritate the eyes. Like you said, you've got bumps. It can worsen affect the meibomian glands and cause dry eye. So in terms of when you would use it, yes, I do prescribe it to patients, but it's mainly for patients that have genuine reasons who've lost their lashes. And there's lots of natural eyelash growth serums out there that you can use as an alternative to a medical one.
What are those?
Well, I don't associate with any brands, but basically botanical products. So serums that have vitamin E, natural oils, that's all really, those are all great factors to encourage growth of an eyelash. And the average, but you have to use it regularly and stick it out because the life cycle of an eyelash is 16 weeks. So it takes time.
Wow. I remember that myth that they don't grow back. I used to be told when we were younger my eyelashes would never grow back. I keep picking them out.
Yeah, I think I'd probably tell my children that as well, but it's not true.
Amazing question. Thank you so much. Oh, there we go. Hi. So I think it's one of these things as such that there's so many different platforms out there these days, and it can get a bit kind of bombarding. But I also think that they do have their place because, again, the busy lives we're leading at the moment, getting to see someone one-on-one on a regular basis, firstly, is quite costly. But then also it's, trying to fit it in a time that both works for each individual is also quite tricky. So with the platforms, it would be very much, speaking perhaps with a specialist to say, because we always do our analysis of the different platforms, and we know which ones are very much regulated with someone behind the scenes checking up on the bits and pieces that are being put out there. And I think the best platforms out there are when there is kind of someone behind it doing kind of one-on-one assessments with the person as well, because we know from a growth perspective, again, that piece that we're all so different, that, one starting point compared to another person's is so incredibly different. I think we're seeing a rise, particularly with running, fantastic apps like Runner. We're seeing some fantastic kind of strength and training kind of bits and pieces like Shreddy, created by Grace. But it's, it's kind of working out where you're starting from is so incredibly important. And, if there's kind of, there's some fantastic personal trainers, particularly a couple of people in this room who have created their own platforms, but they'll always do an assessment first with the person. And I think that's so incredibly important from kind of an injury prevention perspective.
And I think it comes back to Jamie's point about compassion as well, being kind to yourself. If these platforms are constantly available, it can be really easy to overuse them.
100%, yeah. And I think, especially in this day and age when people are kind of, we've just seen 1.1 million people apply for London Marathon, which is just amazing. Everyone's getting out, running and looking for these apps to kind of help them do that. But not, I think it's kind of that comparison piece and being really the thief of joy and, they're doing this challenge, I need to go and, they're running a marathon, I need to go and do 7 marathons as a Sahara Desert. And, it's amazing what people are doing these days, but actually just being really kind to yourself. And we don't, if we're moving in a day, that's fantastic enough. Yep.
Thank you all so much. I'd like to just give our Beauty Triangle a round of applause. And thank you so much to you all for coming. It's so lovely to see more of you. This is our second time here now, and we hope to be back for some more. So, keep in touch. Please pop your details down if you'd like to be connected with that free month of Jamie's app. And we hope to see you again soon. Do follow us on socials as well, because we host these in all different clubs in London and now in Dubai. Thank you so much.